talking with me. If you have not met Dawn Olson yet, why haven't you been by the office? Because she oversees the fitness center. She does a lot of our educational classes. She does our one-on-one counseling. You need to get in here. So come meet Dawn. I'm going to introduce you right now. Dawn, welcome to the Doc Weight Loss Channel podcast, and take it from here.
All right. Hi, Dr. Clark. It's an honor to be here this afternoon, and I'm always being asked certain questions. So these are the questions that I'm going to bring to you today, and hopefully you'll have some answers for us, and well, people will be able to fix some of their issues. The question I get probably the most often is, what's this around my middle? You know, I just had another birthday. I'm 45 or I'm 50, and all of a sudden the weight that I was carrying around my hips is moving around my middle.
Yeah, a common problem. Welcome to middle age. Yeah, we get asked this question all the time. Common question, and actually there are some fairly, I'm going to say, common reasons for this, and they're very real reasons. The weight around the middle, obviously we often talk about that being the least healthy, and so you want to avoid that. But there are some real reasons that occurs, and especially tends to occur as we age. Okay? Now, there are a lot of reasons for that. The weight around the middle tends to accumulate because we tend, as we get older, tend to get a little bit more carbohydrate sensitive, insulin resistant, and insulin is the major hormone that tends to store fat. And it tends to store fat mainly in the middle. It can store fat anywhere, but the tissue that is in the middle, our middle abdomen, that visceral fat, meaning it's around our internal organs, that tends to be more sensitive to insulin. And so as insulin levels go up with age, then we're going to be more prone to having fat getting deposited there. Now, a couple other things really influence that as well. A normal part of aging is that we lose some lean body mass. After about the age of 28 or so, we lose about 1% per year of our lean body mass. And again, it's our lean body mass that actually tends to help us with this insulin sensitivity. And so as we lose that, then we're obviously losing that help. And so subsequently, then we're more insulin resistant. Finally, and probably not really finally, but another significant one, and this affects women, is that, okay, as you get to that menopausal age, subsequently then you find it's harder to lose weight, easier to gain weight, and that's real. It's not in your head. It doesn't mean that, oh, I'm just older. No, it's real, because as women approach menopausal age, there are changes in hormones. I mean, every single woman knows this. You get the hot flashes and all that. And that's because as you age, is that the estradiol levels are going to decrease. As estradiol levels decrease, then estradiol itself is lower. And estradiol is one of those hormones made by the ovaries, but it actually helps you preserve lean body mass. It actually is fairly weight stable. Now, so if estradiol levels go down, that means it's going to be a little easier to gain weight. But the other thing that happens is that another type of estrogen called estrone actually increases. So as we get older, especially women, as they get older, the estrone level goes up. Now, estrone is a type of estrogen that actually is not only made by the ovaries, but it's also made by the fatty tissue. And estrone kind of encourages fat storage. And again, it's fat storage around the middle. So if you had carried your weight around your hips, now as you get older, you say, okay, gee, it's shifting up a little bit. I'm carrying it more around the middle. That's because estrone levels go up. Now, a further compounding problem, though, is since fatty tissue makes more estrone, the more fatty tissue you have, the easier it is to gain weight. And so, yes, it is true that as we gain weight, it becomes easier to gain weight. All those things influence. So there's not really one thing. There's actually multiple things. I wish I could tell you, here's the treatment. Here's what makes it all go away. Well, it's a lot of work. But anyway, that's a very common problem that we see, a common question that we see. Does that help some, Dawn?
Yes, I think that does answer that question, but is there a difference between what men do and what women do to help combat that weight around the middle?
Well, obviously there are differences between men and women, okay? From a hormonal aspect, the men obviously don't have the estradiol. Okay, they make some estradiol. Okay, I'm not going to say they don't have any, but they have very small amounts. So it's not that their estradiol levels go lower. Okay, but men have testosterone. Okay, well, women have testosterone too. Women have about 10% of what men have. Men have much higher testosterone levels, but as time goes on, testosterone also comes down. Testosterone helps you preserve lean body mass. Testosterone by itself tends to be fairly weight neutral. But as you lose the testosterone levels come down, then subsequently you're not able to keep the lean body mass as well. Subsequently, then again, they become more sensitive to the insulin, which tends to fat storage. So the concepts are very similar. There are some subtle, real differences. But even with men, though, their estrone levels will go up because as they deposit more fat, they make more estrone, which is, again, that type of estrogen that stimulates fat storage. And so that same concept will still affect men as well. So it's just a slightly different change on that, but there's some similar type of hormone effects that are occurring there. But yes, they get that kind of that apple shape too, as opposed men typically aren't pear-shaped as much as women are, and that's again just one of the common differences between men and women. So men don't typically then from pear-shaped to apple-shaped. Men often come from, if you want to call it a little more spelt shape to then becoming more barrel-shaped. But a similar problem, similar answer.
Okay. How much does hereditary traits come into play? I mean, just because our mother looked like this or our father looked a certain way, is that going to affect our outcomes?
Maybe. It's the yes and no, I guess. Genetics certainly play a big part in health. Okay, not just weight, but just overall health. And so we can't ignore genetics. We can't just say, oh, it doesn't play into this. Yes, it does. Okay, so the old saying that apples don't fall far from trees is real. Okay, meaning that, okay, we typically are going to have some of the traits, some of the same problems that tend to run in families. That doesn't mean it's not insurmountable. It is. I mean, it can be insurmountable. It may take a little more work because genetics sometimes works against us. But yes, it does come into play, but it doesn't mean that that we can't get around this, because often all of the medical problems that are influenced by genetics can also still be influenced, and sometimes more so, by what we do, what our activity is, what our eating habits are. A lot of the personal behaviors that we develop will sometimes offset all of those genetic components.
Okay, well, that answers a lot of the questions that I get on a daily basis, so that's very helpful. Those are things that I can pass along, and hopefully those watching can pick up on these tips as well. Thank you.
All right. Well, Dawn, thank you for stopping by. I wish for those listeners out there that haven't been by the office, please come by. You can meet Dawn anytime. As well as if you're interested in more information, I'd encourage you, just go to our corporate website, which is www.cfws.com. or pick up the phone, 757-873-1880. Or if you're interested in more of these type of things, watch for our podcast. But I would encourage you also get involved in our Losing Weight USA. The site for Losing Weight USA is losingweightusa.com. So if you go there, you can pick up some tips handouts on a weekly basis, as well as recipes that are done, and then routinely every single week we have a half-hour webinar that goes over all kinds of topics related to both overall health as well as the weight. It's one of the best bargains out there. So, for those of you listening, we'll see you in the next time, and take care.